All right, you guys, we're here today with Dr. Shannon Luznar. This is my friend and my reproductive vet, and she was the one that did the transcervical on the mother of the puppies. And you can see that it was quite successful. So Shannon, tell us about the importance of progesterone testing in any kind of breeding.
Usually what you want to do is once you notice that the bitch comes in heat, about 5 days after you notice any kind of discharge or any kind of vulvar swelling, you want to take your first progesterone. And generally you're taking about every 3rd day after that until you see certain levels that indicate exactly what time to breed.
Yeah, well, what do those numbers mean?
Well, they pretty much are synonymous with like your LH surge and your time of ovulation. So depending on the progesterone levels, you can kind of determine when the bitch ovulates, so then you know when to breed her.
Well, what do you consider ovulation?
Anywhere between 4 and 10 generally on the progesterone levels. So usually you want to breed dogs post-ovulation, so you'll have that number. And then
yeah, why is that?
That's just how they are. That's how the dog is made. They ovulate immature eggs, immature oocytes, and so after they ovulate, they have to go through a maturation process, and it usually takes about 2 days generally, 2 to 3 days they feel like to mature.
I mean, would there be a difference of when you use, natural breed or the artificial insemination?
Absolutely, and it definitely matters on the type of semen that you're breeding with. With natural breeding, you don't have to have such a tight window for your breeding management because you're using live, very fertile semen generally. But if you use frozen semen, which you kind of consider subfertile, you need to time that very, very precisely. And also you're limited to how many breeding doses you have. So generally you're just breeding 1 time with frozen semen. So you want to know exactly the best time during her cycle.
And we know you do the transcervical, and you also said that you do the frozen semen and that you can store it over there at the clinic.
That's right.
And how does that work? Do we just bring the dog in for the collection?
Yeah, bring as far as freezing semen?
Yeah.
Bring in the male dog. We'll usually do a breeding soundness evaluation, depending on their age and what their breeding history has been. Do a breeding soundness evaluation, make sure semen quality looks good. If everything looks good, then we put it through a test freeze, where we actually collect it and test it, and then you kind of know, once you thaw that, what your post-thaw motility is. And then you just, depending on how many doses you want, and how much sperm that dog gives you, then it depends on how many times you want to collect them to freeze
what
semen.
age is the ideal age to do that?
2 to 4 probably. Usually once they get a little bit older, they start getting prostatic issues. So.
And you're all set up to collect and freeze over there?
Sure are.
All right, girl. So we'll end this session for today, but I really appreciate you coming by and checking on the puppies.
They sure are cute. Say hi.
And we're going to have more episodes soon, you guys, and I'm going to put the link to Shannon's website point over there. There, so you guys can click on her website if you need any information about the canine reproduction. She's an expert. I love her. See you guys. Bye.